Okay, so I think we finished Williams. Okay, so in Williams, hypercalcemia is also important. Okay, so hypercalcemia, supraortic valvular stenosis, branch pulmonary artery stenosis. Okay, and then the physical features of happy personality, round faces, full cheeks, full lips, stellate pattern in the iris. Okay, and mental retardation and friendly personality. Okay, all of these are important features of Williams syndrome. Okay, now, okay, we will go on to the next case, Dr. Shumaila. Which one is the next to discuss?
I think the next two important that can come in short stature, one is Turner and one is Noonans and Down. These three are there left now.
Okay, so for Turner's, okay, again, anybody can quickly describe what will
Yeah, we
be the.
already did that in CVS also, no? Turner and Noonan. So can you please recall?
From the hands, uh, hyperconvex nails or hyperplastic nails. Then hands may be short. Then
with metacarpals.
Yeah,
Clin-
and below clinodactyly and short fourth and fifth metacarpal. Then up when we go, the carrying angle will be widened. Then BP, coarctation of aorta, hypertension. Then when we go up in the face, you'll have ptosis, hypertelorism, antimongoid slant, and high arch palate, dental crowding, and then neck, short neck with low posterior hairlines and webbing. In the chest white space, nipple, and there may be scar of the surgery. Or you can find the findings post surgery, or if the surgery is not done. Then in the abdomen, horseshoe kidneys and other renal anomalies. Then Turner, then there may be a delayed, if it is a delayed puberty, signs of delayed puberty.
Okay.
And back kyphoscoliosis may be present.
Excellent. Okay. In the ears, glue ears.
In the ears, yeah, glue ears,
Glue ears, prominent ears, hearing aid can.
yes.
And what else? What are the different what else you would look for to complete your examination in Turner's?
Developmental assessment, then complete Tanner scaling.
Excellent.
And then pubertal assessment and hearing and vision.
Excellent.
And neurodevelopment, that is, and cardiac.
Cardiac.
BP and all four limbs would be.
Cardiac, abdomen. Okay, and one thing I would like to hear. Turners, they have high chances of autoimmune
cancer and autoimmune disease, and I think Turner's leukemia. Leukemias, cancers, and autoimmune disease, thyroid and celiac.
Thyroid and celiac are more common in Turner, leukemias more common in Noonan.
Downs.
Sorry. Turner's ovarian cancer. Sorry. Turner ovarian cancer.
Ovarian. Turner.
And Noonan, it is leukemia. Sorry.
Leukemia, hepatosplenomegaly is more common in Noonan. In Turner, you have to specifically screen for thyroid and celiac and diabetes. Okay. And horseshoe kidneys are there. So kidney, echo will be there. Ultrasound abdomen will be there. Okay. Renal function test, thyroid function test, celiac screen, blood sugar, sex hormones. And what is the diagnostic test for Turner?
Karyotyping.
What is the defect in Turner?
X0. One X.
How many chromosomes?
22.
45 XO.
45. 22.
Okay, so 45 XO is the karyotyping.
Yeah.
Okay, and how will you manage these cases?
Multidisciplinary team, involving pediatrician, then ophthalmologist, ENT surgeon, then cardiologist, then orthopedician, then endocrinologist, then nephrologist if there is complication, then social worker, then they have to liaise with the school, then dietitian, then and during the time of puberty, growth hormone also by endocrinologist, very important, and sex hormones at the time of puberty.
Very good.
And psychological support.
Okay, excellent. Okay, then we'll go to Noonans. What will be the features of Noonans? Anybody else can describe? So as you'll enter, what will you see? And what dysmorphic features will be there? Any distress, disease, dysmorphism, deformity, device? Start from that, okay? Anybody can volunteer and quickly describe it because we've done this before.
It will be a revision, huh? Don't worry. Just revise as much as we can. Try to memorize because you know these syndromes are very important, especially Turner, Noonan, and Downs.
So again, in this, the hand will be the short fourth and fifth metacarpal bone, and in the arms, like there will be the wide carrying angle, and the axilla there will be the delayed axillary hairs, delayed puberty will be there. Then again in the neck there will be the webbed neck, and low hairline will be there, short neck. In the head we can find there will be the downward slanting of the eyes, hypertelorism, and in the eyes maybe we can find skewntertosis maybe. And
Very good.
there will be high arch palate, and a epicanthal fold will be there also. Apart from this, in the chest again there will be the wide space nipple, and we can find in the chest, like CVS examination, we can find the pulmonary stenosis can be there. And I think in the Noonan syndrome there will be renal hypoplasia in abdomen. There will be renal hypoplasia, and again we can comment on the genitals. So there may be small in size.
Cryptorchidism.
Cryptorchidism. And these,
on the skin.
and on the back again there will be deformities like kyphosis, sclerosis.
And what about the
Okay.
chest also? No, chest you didn't mention anything on the chest. What can be there?
Why
Deform-
the face nipples, and there can maybe a scar may be present after surgery.
What is
And
the
white space
cardiac
nipple,
abnormality in Noonan? Most
pulmonary
common.
stenosis,
What else?
and the Noonan
Pulmonary stenosis, VSD, hypertrophic cardiomyopathy.
hyperobstructive cardiomyopathy can be there.
Okay. And the same as you mentioned, like the genitalia, cryptorchidism is there, and the abdomen hernias.
Abdominal hernias are also there in the Noonan.
And the skin, what you will find on the skin maybe?
In the skin, cephalotus spots.
Something else also?
There can be bruises, petechiae because of thrombocytopenia.
Yes, there can be bruises, petechiae, because it affects the chromosome, I think 12,
12,
and
yes.
it will be also the chromosome of von Willebrand disease. So we can
Exactly.
also ask about the history of bleeding tendency from the mother also.
Exactly. So the
bruises can
bruising
be
and
there.
bleeding will be there. Okay. Chromosome 12 defect is there. That's why. And there are chances of malignancy. So that's why hepatosplenomegaly also there in the abdomen, hernias and hepatosplenomegaly. And both Turner's and Noonan, that one also cubitus valgus also there, right? So do check with the arms.
Yes, carrying angle.
Yes, carrying angle. Oh,
Carrying angle I mentioned.
good. Very good. So what
Okay.
else you would like in order to complete what else you would say in this?
So in order to complete my examination, I would like to do the developmental assessment, pubertal assessment, and cardiovascular examination of this patient, and also in endocrine examination, hearing assessment, vision assessment.
Okay, okay. So that is
And we
important
also
if it's a syndrome.
genital examination of this patient also.
Okay, good, very good. So that is the important features for Noonan syndrome.
Mhm.
Okay.
Okay, and then I think downs. Shall we discuss downs? I think have we discussed downs before? So quickly, can somebody describe the features of downs?
In the Down syndrome, we can also found in the hand like there will be a single palmar crease and clinodactyly will be there.
Short, chubby hands.
Short chubby hands along with this short chubby hands.
Okay.
And single palmar crease.
What else?
Clinodactyly.
What?
And then in the
head.
In the face, we can find like upward slanting of eyes, apicanthal fold, and in the eyes we can find the like refraction errors like myopia, strabismus, squint. We can find and cataract, glaucoma like these.
Mm-hmm.
And there will be
depressed nasal bridge, high arch palate,
depressed nasal bridge, high arch palate, low set ears,
prominent tongue.
prominent tongue will be there. And
But
there are also short stature, so short neck will be there.
short neck, thyroid swelling can be
Thyroid.
there. Okay. In the chest, there can be scars. Yes.
Scars of the CVM.
Okay. There could be murmurs. Okay. Depending on what is the situation. What else?
We can all defect our ASD, VSD. These are common in the down.
Mhm. Okay. What else? In the abdomen, splenomegaly is important to check. Okay.
Yes.
Okay. Okay. So that is the important
And the
things.
foot will be the sandal gap will be there.
They can
Yeah.
be some surgical scars also, na, on the abdomen. It can be possible. Like they have some duodenal atresia or Hirschsprung disease. They are common for Downs.
Yes.
So look for the abdomen
Because
surgical scars.
in abdomen there will be they have the like diseases like tracheoesophageal fistula, duodenal atresia,
Yes.
Hirschsprung disease.
So any scars in the chest and abdomen that are important, okay? There can be hearing impairment, so the hearing aid also, you have to check the ears also, always in syndrome. Like whether the child is able to hear or he's wearing a hearing aid, okay?
Yes.
Good, good. Learning difficulties, maybe developmental delay, they're associated, okay? And thyroid you already mentioned, good. So what are the investigations you will do for a case of a Downs?
Here also will be the definitive test will be the genetic testing, karyotyping will be there. And apart from this, some blood workup like at the birth, CBC is important to see the any see for also leukemia. Leukemic for the blood signs we can see for neutrophil for, as they are immune deficient, and for the signs of leukemia. And hearing assessment is important in the investigation. So audiology assessment and ophthalmological assessment.
Okay.
And
Thyroid.
thyroid function
and
test,
celiac,
celiac
huh?
screening,
Okay.
thyroid function test, and musculoskeletal X-ray spine is there for atlantoaxial ability and other
Okay.
spinal problems.
Good. What is the most common genetic like mode of like transmission? What is the most common defect in Downs?
Non-disjunction.
Yes, very good.
90, I think it is
Yeah,
non-disjunction.
more than 90. Yeah, good.
Okay.
So that was
Then
about short stature. It is very important, na? All those
MPS
that were.
also there, but we've discussed it already in the abdomen. Okay, so but don't forget, MPS can be a case of short stature also. Okay, so you're aware of the features, and we discussed all those skeletal findings and the blood tests. So please go through that also. Okay. Okay.
Tomorrow
Next
is
week.
actually Sunday, so you guys can stay awake still a little bit later. It's okay because we have this short stature. Now we want to do some cases for tall stature. Is that okay?
Okay.
Yeah,
Yes,
because
yes.
now the exam days are near, so better we will discuss few things so you can go back to them also, and inshallah tomorrow we'll do the mock. So let me see if I'm able to see some tall stature.